Hi and welcome to Hoxton Therapy. This is a narration of one of our articles. Severe morning sickness, or Hyperemesis Gravidarum, can be associated with depression. Hyperemesis Gravidarum, HG, a kind of morning sickness, is a chronic condition which affects nearly 2% of pregnant women in the UK. This is more serious than the common morning sickness and is the most prominent reason the bed rest for pregnant women. The severity of this condition is that it can persist till after childbirth. Women can be bed rested for weeks and can suffer from dehydration as well as weight loss and can be incapacitated to take care of other children. The study was conducted by researchers from Imperial College of London and Imperial College of Healthcare NHS Trust, and it was discovered that about 50% of women suffering from HG also suffered from antenatal depression, and 30% had postnatal depression. Among the women with HG condition, only 6% experienced antenatal depression, while 7% suffered from postnatal depression. Dr. Nicola, a lead author in the current study, believes that the psychological effects of HG condition has been taken with levity by both the healthcare professionals and the larger population. Women who suffer from HG are 8 times more prone to experience antenatal depression and 4 times more prone to experience postnatal depression. Dr. Nicola Mitchell-Jones. The study also showed that many of the women with HG reported to have thought of self-harm at some points in the time. This study result is rather shocking and alarming, and the treatment that women receive should be taken seriously in line with the findings. There is a need to look beyond the physical symptoms of HG and integrate regular assessment into mental health support for women suffering from the condition. The study. The research employed 214 women participants in their first pregnancy trimester from Chelsea and Westminster Hospital NHS Foundation Trust, St Mary's Hospital and the Queen's Charlotte and Chelsea Hospital. Half of the clinical samples were on admission to the hospital with symptoms of severe morning sickness. The other half of the participants were the control group, have no symptoms of vomiting and nausea, and were from the midwifery antenatal clinic. Pre-study showed that none of the women samples had received mental health treatment in the last year in the study. The psychological well-being of the women was measured in the first trimester into pregnancy and 6 weeks after childbirth. Among the women with symptoms of HG, at least 49% suffered from depression during the pregnancy stage. This was way lower to control group, having only 6%. Only 7% of the control group suffered from postnatal depression, and that has also lowered when compared to HG group with 29%. About 50% of the sufferers of HG reported to have taken about 4 to 5 weeks off during pregnancy or after pregnancy. Relationship between HG and maternal infant bonding. The study found no significant relationships between HG and maternal infant bonding. Moreover, previous research has shown that depression has a negative influence on the bond. Regrettably, 8 women showed the symptoms of HG in the study, aborting their pregnancies despite the fact that they really wanted to keep their babies. The author noted that although HG couldn't be associated with the reason for the abortion decision, it could have played some roles, and this is devastating, said Dr. Mitchell-Jones. Talking from the experiences during her first pregnancy in 2018, she noted how frequently she was in and out of hospital almost all of the time, having spent at least 6 months in bed. Fortunately for her, she had good social support both from her employer and family. Women don't get a lot of time off work, and many times partners, colleagues and relatives aren't there to provide the support the pregnant woman needs because they really don't understand the severity of the pregnancy period. People and healthcare professionals need to be educated. Dr. Mitchell-Jones, however, hopes that his recent findings will help in the improvement of the present knowledge about HG and adjust current clinical guidelines on how pregnant women with severe morning sickness, HG, are treated to include psychological assessment and referred to special mental health clinics. Tanya Wood's experience with HG. A participant who took part in the clinical trial, Tanya Woods, who is an operational director of a business in Hammersmith, shared her story when she conceived her now 3-year-old daughter, Tallulah. Tanya had suffered 2 miscarriages 18 months after suffering from endometriosis for more than a decade. She and her husband, Stephen, had planned for IVF after their blessing in August 2016. However, by August 14th the same year, the couple realised they were 6 weeks gone, so they were happy and scared at the same time. Later on, their IVF consultant transferred to Tanya to the early pregnancy unit at local Chelsea and Westminster Hospital in order to keep a close watch on the pregnancy. Hormones were also prescribed to support the pregnancy. After the wedding, the couple went on honeymoon a few days, and by the time the pregnancy had clocked 7 weeks, that day she started feeling unwell. It set off when she began perceiving offensive odour and feeling hungry at the same time. According to her, it was if she didn't eat, she would pass out, but this was actually the symptoms of nausea, and when she attempted eating, she vomited. After returning from the trip the following Monday, Tanya resumed work, but the nausea wouldn't let her work, as it kept worsening. By the time she consulted her GP, she realised it wasn't normal morning sickness. I respected my GP so much that I really didn't think he understood how uncomfortable I was feeling. He was conversant about my previous miscarriages, so to that effect he suggested that I avoid taking medication to prevent affecting the pregnancy, and that was what I was experiencing, with good signs that the pregnancy was still intact. The symptoms were persistent for days, whilst making concentration at work unbearable. In fact, many days I found it very difficult to get out of bed because the nausea would rage any time I tried to make a move. The experience was like the most painful experience I had ever had. The following week, Tanya and her husband returned to follow up for an appointment with early pregnancy unit, where she met Dr. Nicola Mitchell-Jones, a HG specialist. Dr. Mitchell-Jones saw how dehydrated Tanya was, and she immediately placed her on an IV drip in the treatment room. It was a very fortunate moment to have Dr. Mitchell-Jones because I felt I had finally met someone who understood me. After spending 2 hours on the drip, I felt better almost immediately, and by the time I left the hospital, I could eat a little quantity of sandwich. I was placed on IV fluids every day for 2 weeks, and the ambulance unit, my work colleagues and boss supported me during this time off the IVF treatment daily to almost rest a lot. By that time, I had lost a lot of pounds and was looking so thin and felt tired all the time. At one point during my treatment days at the ambulatory unit, they couldn't find my veins, just to explain how lean I was. So they eventually found one inside my ankle, which they used to connect the cannula. I was extremely afraid of losing my baby for the second time, but at the same time I was thinking about continuing to keep the pregnancy, if it would go on that way for 9 months. That was thoughts coming from HG. Many times I was depressed when I saw other pregnant women doing pretty well with their pregnancy and looking blooming. But mine was just too discomforting, stressful and emotional, so I would think that having kids was not meant for me from the outset. I felt so alone and isolated, even though my husband tried his best to support me. Tanya was placed on anti-sickness medication on danzatron, and after a few days after, nausea and vomiting ceased, making her able to eat only certain foods and liquids. It was unbelievable that a drug could relieve nauseating feelings and vomiting was available, although not a perfect drug. I felt much better than when I couldn't gain access to it. I was only eating ramen and Rice Krispies for a week because they were the only kinds of food I could swallow. Normally I could go for broccoli because I really love broccoli, but thinking of it actually made me sick. So around Christmas 20... Never act on any advice given in these articles, videos or audios. Always seek professional help before acting on anything you read or watch or listen to on this website, or in our podcast, or on our YouTube channel, or anywhere on our social media.